I'm Sarah Neslin, and today I will be interviewing Crystal Miller about Louisiana's new Healthcare Reform Act. Hi, Crystal.
Hi, Sarah.
How are you?
I'm good.
So what will this new transition from a fee-for-service to a managed care system mean for the people of Louisiana?
Well, for the people, it's going to provide a more cost-efficient plan overall, and it's going to lower the cost and hopefully increase the enrollment for the lower income bracket.
I see. So in one of your recent articles I actually just read, it said that the managed care network will actually increase the coverage of Medicare beneficiaries. Can you explain to some of our people out there how it will actually increase the care?
Okay. Well, first, Jindal and his administration plan to put a better focus on preventive care and to decrease the incentives that many providers have for unnecessary treatment. And so by plans focusing more on the prevention, their plans will be at a lower cost, and with a lower cost you would get an increased enrollment.
Okay. So what are your predictions for the new enrollment for the new managed care program?
Well, our early predictions are that at least 380,000 of the uninsured will enroll under the lower cost plans.
Oh, okay. So, as with any new healthcare reform or any new initiatives, there are going to be some barriers. Is Governor Jindal expecting any particular barriers or any particular problems that might happen?
Yes, he actually did focus a lot on early initiatives for healthcare reforms, and through those reforms he did address their problems and hopefully has adjusted for those as necessary before the plan did actually switch, so that it's not fixing the problems afterwards.
So, Crystal, has Governor Jindal used any previous or any prior initiatives to kind of model his new system?
Yes, he actually did focus on 3 states in particular, Florida, Tennessee, and Kentucky, of which Kentucky did have the better of the plans, and they've stuck around the longest with their reform. And so he's using their initiatives, their good and the bad, to model his reform afterward.
So with the state of the economy, how does Governor Jindal propose to actually fund this new program?
Well, the majority of the funding for the Medicaid as it stands now does come from the HHS. And so for this new plan, he's going to use that same funding, and he's also asking for additional funding to help expand the coverage.
Ah, well, how informative. Crystal, thank you for being on my show today.
And thank you. Hi, this is Crystal Miller, and tonight we're speaking with Sarah Neslin about the electronic prescribing technology. So Sarah, what exactly is this policy about?
So electronic prescribing is a new technology that's being integrated into hospitals and private practices as a means to improve overall health care that's delivered to the patients, whether it be by reducing physician errors or by reducing the number of wrong prescriptions that are written. It's just a movement to help improve health care for people.
Okay. And are physicians voluntarily integrating this program, or is it like a government mandate?
So it's going to begin where physicians who integrate the program or who have already adopted it will receive a 2% bonus in January of 2009. And then in January of 2010, more physicians who have integrated it will receive a 1.5% bonus, and then in 2011 it'll be a 1% bonus, and so on. So it'll tailor down until in 2013, physicians who have not adopted the program will actually be penalized for not adopting electronic prescriptions and using that technology to write their prescriptions. At that point, they'll actually be receiving less funding from the federal government for their CMS programs or Medicare and Medicaid programs. So it'll start off in 2013 when they will receive 0.5% less, and then in 2014 they'll actually receive 1% less of what they initially received from the government.
Okay. And where are the funds for these federal incentives and bonuses coming from?
So it's going to come from a trust fund that's set up in the federal government. The federal government has actually allocated $100 million for the integration of this program.
Okay. And do you foresee like any problems or any issues with like constant software maintenance, or if the systems go down, how are they handle that?
So as with all computers and all technology, there are always going to be computer glitches that will happen. There's going to be new software programs that are going to come out, better systems. There's going to have to be some type of computer maintenance that's going to have to accompany each one of these programs. So for hospitals and doctors' offices, we're envisioning there being about $80 to $400 per integration that's going to have to cover just maintenance fees and just software upgrades. But that's all taken into account in the $100 million trust fund.
Okay. And just another issue with like patients' privacy, is that basically being dealt with through the technology, or how are they going to handle that?
So even though this is technology, and even though this will be, all of the electronic prescriptions will be exchanged via an internet web circuit, it's all maintained under HIPAA, the Health Insurance Portability and Accountability Act. And so all of the information will still be considered personal and private and confidential for the patients.
Okay. And that's all the questions I have for you today, Sarah, and thank you for joining us.
Thank you.